What's happened here in the U.S. is now that we have about 90% of the country is wired, and about 3/4 of them are, 2/3 are on smartphones now. The velocity of which we're seeing the uptake of those devices is absolutely amazing. And as a result of that, we have very high expectations about what we want, when we want, where we want it. And those devices are becoming the means in which we access and communicate with people, get information, order things from Amazon. And healthcare is at the forefront and in the sights of the last big institution that's going to change as a result of that. We're moving from sick care to actual health care. We now have devices that have the ability to monitor and sensors that can do biometrics. We're going to see a whole shift to actually monitoring, and there's amazing things that are happening that this panel could certainly talk better than I in the actual medical practice that's going to make the entire way that we live and think about living.
Smartphone today has more computing power than Apollo 11 did when it reached the moon. You know, that's an amazing statistic. You know, you usually check on average, at least Americans do, from a time poll, your phone every 6.5 minutes, which is about 150 times a day. 68% of people sleep within arm's reach of their smartphone or mobile computing device. So what better way of reaching that endpoint user, as David was referring to, than through a computing device which knows who you are, understands your trends, knows who you contact, knows who you like because you tell it through Facebook, I like such and such, and has augmented reality to tell you what's going on around you and now with you and even on you if you have some kind of a sensor or a wearable. Meaningful use was supposed to incentivize doctors or eligible providers, so doctors and hospitals, to embrace health information technology. But there's something missing in that, unfortunately, because what they've done, in essence, is really defined health IT as being electronic health records. One of the core requirements in meaningful use is actually to enable and engage patients and families in their care. But until recently, most of the stuff that we would envision actually doing that has not been part of the meaningful use incentive payment program. One aspect that I believe at least the telecommunications industry and the ICT industry and even parts of the health information technology industries agree on is this ability of uploading patient-generated health data somewhere into a record.